Good afternoon. Thank you. I'm very excited to be here. My name is Daniel Sabotin. I'm here with Epiciti Mobile Dental Care, and Epiciti provides on-site mobile dental services for generally seniors who live in nursing homes, retirement homes, hospitals, or for private home care. So if you know someone who can't get out because they have mobile impairment or they have difficulties getting to the dental office for any other reasons that involve disability, we can actually provide some of these services at their home or on site at either a long-term facility or a retirement home. Sometimes what happens when someone's admitted into a hospital, because they're in there for a while, they may actually lose weight or they may gain weight, and that can affect parts of their oral hygiene. So I'm here to talk to you about today why oral hygiene is important. Now, we all like to have good teeth. We all like to keep them clean. We all know that it helps us smile more, and we're a bit more approachable that way. But your mouth is the gateway into your body, and the condition of your mouth is going to be the reflection of your overall health. So if you have been keeping up with some media on oral health over the last 5-10 years, more and more studies are coming out and are demonstrating the very close connection between oral hygiene and systemic health. So poor oral health is linked to some systemic conditions like osteoporosis. It's also linked to increased chance of having a stroke, a heart attack. In fact, you're much more likely to have a heart attack if you have poor oral hygiene. You're also more likely to developing diabetes, digestive problems, and respiratory problems. One of the biggest causes of death in long-term care in North America is pneumonia. And pneumonia is really bacteria that gets aspirated, gets lodged in your lungs, and really that's when all the problems begin, with inflammation and any kind of infection that basically prevents you from breathing. Now, the connection with your mouth, of course, is if you have poor oral hygiene, if you're not able to regularly maintain and upkeep your the condition of your mouth, there's going to be a lot of bacteria that's going to accumulate there. Generally, on any day or any time of your day, we have about 600 to 800 different species of bacteria in our mouth. So you can see there's a lot, it's a huge host of microorganisms living there. If you're not making daily contributions to cleaning this through either brushing, flossing, this is the kind of bacteria that not only causes inflammation in your gums or teeth, but this is something that you can aspirate really easily. As we age, especially for the seniors, their gag reflex starts to deteriorate a little. They're not able to cough. Their cough reflex is weaker. So if they're inhaling some kind of saliva that contains bacteria, they have a much harder chance of coughing that up, and that bacteria can get lodged in their lungs. So it's very important to maintain good oral hygiene. The first thing that people notice about you is your smile, and having a great smile is a great first impression. So not only do you get physical benefits from it, but also the social benefits that come with it. First of all, you feel more confident. You're more likely to smile whenever you're in social settings and whenever you're with your loved ones. And also it allows you to avoid some of the awkward moments we've experienced with someone having bad breath. I'm sure we had a coworker or we had a friend who just has chronic, persistent bad breath. And so these are indicators or other social benefits that you can get out of having good oral hygiene. So what are some oral hygiene care tips and techniques that you can use in your home care environment? First of all, brushing is the best way to keep your teeth. So if you want to keep your teeth, you got to make sure you're brushing. Now, I know we all probably brush, and it is strongly recommended that we brush at least twice a day or after meals if you can, incorporate that into your schedule. So when you're brushing, what you're doing is you're physically brushing and, scraping away your teeth of what's called plaque. Plaque is a constant nightmare in your mouth. Plaque is an accumulation of different types of sugars, carbohydrates, proteins, all kinds of substances that act as an excellent place for bacteria to stick. And so what you're doing is with your brush, you're just getting rid of that plaque that builds up. And if you don't, within 24 hours, if you don't brush your teeth, that plaque starts to harden and it turns into calculus. And that is why it's important, because you can't brush away calculus. And that can only be done at your dental office. So with disabilities come a lot of common oral conditions. And some of the top oral conditions that would be experienced would be gum disease, which is, you might have heard of things like gingivitis, periodontitis. In fact, tooth decay and gum disease are the #1 disease that affects people. It's not cancer, it's not anything else. Your teeth are organs. Your gum is a part of your body. It's a tissue that can easily become inflamed if you do not take care of it. It can now start to deteriorate the tissue, the underlying bone. It can lead to decay of your teeth. Your teeth will get loose, and you can eventually lose them. The problem with that is if you don't have teeth, you're having less likely of a time to eat healthy foods. You're not getting the nutrition you need, you're not getting the vitamins, and that can affect your overall well-being. So what can you do about brushing? If you have certain mobility impairment, or if you have arthritis that's debilitating and you can't hold a toothbrush, there are toothbrushes on the market that have slightly thicker handles, okay? The other alternative is to get an electric toothbrush. And electric toothbrushes are a great way to not only promote health, but also do the work of actually brushing, because they do all of the brushing for you. Secondly, just the design of the electric toothbrush. The handle is much thicker, so if you're having any arthritic pain, you're more likely to grab that handle. And of course, get into the far to reach areas. You can get these products at most department stores, and they're fairly inexpensive nowadays. So it was about 10 years ago when these things came on a very commercial market. They were very expensive, but now they're actually quite affordable. There are different types of toothpaste. Toothpastes are a great way to just polish your teeth, keep your breath fresh. People always ask me what is the best toothpaste to get. Generally, they all serve the same function. If you prefer certain types of flavors over others, or you see a great deal at some kind of a department store, that's your call. Otherwise, unless you have sensitive teeth, okay, you hear about products like Sensodyne or sensitive toothpaste. If you have some kind of sensitivity to hot beverages or cold beverages or eating ice cream or drinking coffee, this might be your first indicator that you have sensitive teeth. So Sensodyne is a great product to use for that, or now you can look at any shelf for anything that says sensitive toothpaste. Tongue scrapers are a great way to remove the bacteria from your tongue. Our tongue is like a sponge. It absorbs a lot of bacteria, and especially odor-causing bacteria. So a tongue scraper is an instrument, it's a handheld little instrument that helps you gently scrape over your tongue. It doesn't really scrape, it just kind of brushes off all the bacteria and all the debris that builds up from your food. And the first time you see what comes off, you're going to want to use it more often. Flossing is often overlooked, and it's very difficult if you have impairment in your hands, in your wrists, if you feel pain, especially like arthritis. And very often people with dementia forget to do this, so it's very important for a care provider to help them and assist them with flossing. And there are a lot of great products on the market that are available to assist caregivers or anyone who cannot do it themselves. Or if they have some difficulty, there are some assistive devices that can help you do it more independently. First and foremost, flossing is critically important. People sometimes ask, do I need to floss every day? Really, the best answer is, if you want to keep the best answer is only floss the teeth that you want to keep. Because flossing, the bacteria gets lodged in between your teeth, and there's just no way for that brush to reach that. So flossing generally requires a piece of floss. If you have impairment in your hands, there's something that's called a floss fork, and you have seen these possibly on TV. It's essentially like a little fork on the end that has a piece of floss attached right in between, and they come in different variations. You can get ones on a handle, so if you have any pain, you can easily grab that handle and go to the far to reach areas in your mouth. And another wonderful product in the market is what's called the water pick, and basically it uses fine stream of water to flush any debris that's accumulated between your teeth, and it helps maintain healthy gums. And I can't stress enough how important healthy gums are, because it all starts from there. As a bacteria accumulates, it can now progress to your teeth. So keeping healthy gums is a great way to keeping a healthy you. So if you have any crowns or bridges, the water pick is also a great instrument to flush anything out under there. And water picks are available in most department stores, and there are different variations, and they're a handheld device with a little water basin in there, and it shoots that water from that reservoir there. Now, there is really no way to avoid the dental office. Because with all of our efforts with brushing and flossing and rinsing, one of the biggest problems is there's a lot of bacteria that accumulates in areas where our floss and our brushes can't get to. So getting to a hygienist to do your regular cleanings and checkups by your dentist are crucially important, because if you're not able to eat healthy foods, that may affect you or progress your condition. So cleanings by a professional dental hygienist can avoid a lot of the tooth decay. They're able to monitor anything in the mouth that may be suspicious. Very often we hear about things like oral cancer nowadays. At the dental office, this could be screened, and it could be done early enough to ensure that it doesn't develop into something more severe. Now, I work with Epiciti, and we provide on-site dental services. So if you can't make it to your dental office because you're either in a wheelchair or you're bedridden, or you may just really also have some kind of phobia of going to the dentist, we can provide these services in the comfort of your home. And sometimes it comes with aging. Sometimes people can't get up to the second floor of the office to see their dentist. So this is why our services are available for anyone with disabilities, seniors as they age that have a hard time getting out, or if someone has a mobility impairment. But also it's another way to also have dental care conveniently in your home. So if you wear dentures could be very difficult to clean, especially as we age. We may sometimes either forget to clean them, or we might not have the motivation to clean them, or sometimes we have a hard time using our hands for manual dexterity, especially as we age, or if we have any type of developmental physical condition. So one way that you can do is, if you have a caregiver, a couple of quick tips. If you are cleaning dentures, never clean dentures with toothpaste, because toothpaste is a abrasive and actually scratches the denture. And with a lot of these scratches, it introduces a lot of bacteria now that you're going to be taking back into your mouth. So if you're assisting someone cleaning their dentures, make sure they're using lukewarm water. Never put your dentures in the microwave to disinfect them. Sometimes there's a notion out there, if you put your dentures in a cup of water, put in a microwave, that'll nuke all the bacteria. Unfortunately, if it does anything, it warps your denture, and then you have other problems. The other thing to consider is getting a proper brush, whether it's for your dentures or for your teeth. There are special brushes designed. They're triple-headed brushes, so you won't need to do specific motions that are recommended by most dentists. It has brushes that basically brush at all three surfaces, from the side, from the inside, and from the top, all with one stroke. Okay, so if you have impairment in your hands to that extent, that's one solution. The other thing that's important to recognize with dentures, they should also be replaced very often. Not very often, at least 5 to 7 years, because they start to wear down. The teeth are plastic, and as we chew and eat, that wears the teeth down. And so essentially now you have two flat planes that are trying to chomp the food, and it's not happening. So dentures should always be stored in water. So sometimes people forget to take them out, because if you have certain types of partial dentures basically replace certain missing teeth. You still have some of your natural teeth, but if you wear partials, you have little clasps and hooks that hook onto teeth. It's sometimes very difficult if you can't get your arms or your hands inside your mouth to unclip it. So what happens, sometimes people will leave their dentures inside their mouth when they're asleep, simply because they don't have the ability to take them out. And so that causes a lot of bacteria to grow, and that can cause a lot of inflammation, pain, and it can cause a lot of discomfort altogether. So how do you know when to get help? If you feel that you have bad breath, it's persistent bad breath, you have loose teeth, if there's discoloration, or you haven't had a dental cleaning in a while, that might be a good indication that you may either need to see a dentist or get someone to help you or explain some home care procedures for your caregiver. If you have any type of pain, discomfort, if you have loose dentures and they're rocking inside your mouth, very often people will avoid certain foods because of that, and that can affect their nutrition altogether. If you're using a lot of denture glue, or if you have cracked or broken dentures, that might be a good idea or a good time to consider seeing professional help. Now, I understand that if you can't get out, it's very difficult to seek oral health or access to dental care. So I just want to let everyone know that if they know someone, that they have a friend or family member that needs any type of services where they can't go to dental office, at Epiciti Mobile Dental Care, we can provide these services for you. So that does conclude our little presentation here. And so if you have any questions, we're always open. Our lines are open. Our emails are open. Feel free to get in touch with us, and we're here to help you to address any oral care needs that you have. Thank you.